Hello, welcome to our mental health podcast. I'm Jack, and I'm with Ricky and Luca. Today, we're going to be discussing GAD or generalized anxiety disorder. Generalized anxiety disorder is a type of anxiety disorder that is characterized by persistent and excessive worry, anxiety, and fear daily. Anxiety is a normal part of our mental health, but in generalized anxiety disorder and other anxiety disorders, this anxiety and worry becomes pathologic and interferes with life on a daily basis. There is no one single cause of GAD, and it is often a result of a combination of things in our lives. This includes our stressors, predispositions, mental health, family history, health problems, neurotransmitter balances, and much more. Anxiety related disorders are often co occurring in many people. Having one form of mental illness can be a risk factor for developing another one. GAD, especially, can be found often with one or multiple other mental conditions. A more acute mental illness can trigger the chronic anxiety response found in GAD, resulting both in an acute anxiety condition and a chronic GAD. This results in daily anxiety that interferes with functioning and can be classified as GAD. In the same way, other mental health disorders such as phobias, obsessive compulsive disorders, and social anxiety disorders can also trigger GAD. Substance abuse can also lead to substance induced generalized anxiety disorder and anxiety attacks. Okay. Anything to add, guys?
No, it's pretty spot on. No,
That's it. Ricky, why don't you take us into some of the physical symptoms of
physical.
JAD?
All right. Yeah, sure. So, physical symptoms of anxiety include nausea, shortness of breath, chest pain, irritability, restlessness, heart palpitations, feeling lightheaded, muscle tension, and much more. These physical anxiety symptoms are occurring with mental distress, worry, intense fear, and they characterize anxiety. The physical symptoms can also be further anxiety provoking, leading to worse mental symptoms and possibly anxiety attacks. So that's basically like the physical symptoms of what anxiety would do to you, or GAD.
So, Ricky, what is the correct solution to treat JAD? Like, is there a singular way to treat it?
Well, with most mental health, um, there isn't one correct way to really treat anything. It really depends on the person, but for GAD, and it's the same for GADs, right? There's not one way to just correct it. There's many possible ways to do so. And if you want to get into that, I'd be my guess.
Yeah, sure. So, one of the more popular ways is pharmaceutical medications, antidepressants, or anti-anxiety medications are helpful in reducing symptoms associated with anxiety disorders and GAD. Um, Something I personally recommend is always like seeking the help of a health professional. Therapy, including cognitive behavioral therapy, has been shown to be quite effective in reducing anxiety symptoms for multiple different anxiety disorders. Um, Even something as simple as being able to calm one's nerves has been shown to help because general anxiety and other anxiety disorders are characterized by an increased response to the central nervous system. So using different relaxation techniques like meditation, breathing exercise, just a bunch of different ways to take your body out of that sort of fight or flight state that anxiety puts you into, and rather put yourself into the moment is usually a very good way to sort of stop an anxiety attack. Not necessarily stop, but sort of lower your overall its overall impact on you. Um, Another way you could do it is by treating co-occurring mental conditions and mental illnesses, as typically they go hand in hand, as said before, with like antidepressants, being able to use those and sort of things. And something that is very important is just being able to take care of one's mental health. Um, Eating good food to help your brain function properly and being able to eat lots of nutritious stuff for everything. Um, Decreasing the amount of stress inducing things in your life. If you know certain things cause you stress, like an increased amount of stress because it's like a normal level of stress, then getting rid of those is probably good. Like if you have a phobia of spiders and working with spiders, um, focusing on incorporating things that you love into your daily life just to help you calm down and be able to relax. Getting sleep. Sleep is so critically important, especially when you're young too. in order to helpfully develop your brain and being able to sort of calm down. It's shown to release stress. It does so many things. And finally, having like a very good support system is just a is always good to lean back on because you're never alone, and that's something that's very important to them. Especially because when you're having an anxiety attack, you often feel alone. So yeah. And speaking of that whole alone feeling, that actually leads pretty directly into the stigma that circles general anxiety disorder, and that's the fact that it doesn't exist. General anxiety disorder is typically said to sort of just be a fake thing. Oh, you're faking it for attention. You're just making it up. Oh, get up. You're being silly. It's not actually that bad. Whatever. When you're having a panic attack and hearing all these things can be very stressful. Jack, if you have any sort of ideas more to build on that.
So as Luca was saying, it's very unfortunate that the stigmatization around JD revolves around basically denying people that they have this disorder, and it's really hard that way because when other people are denying what you think you have, it's harder to then confront and feel safe in consolidating with other people as mental health professionals, because you won't feel like you have something real, and that makes it hard to discuss with other people, if you know guys know what I mean.
Yeah, 100%.
Yeah. So it's really important if someone comes to you with, if even if it's not JD, any kind of anxiety or something, it's really important to not dismiss what they're telling you and to treat it like it's important and it's real, even if you think it's not. Like, make them feel safe around you and make them feel like you're someone they're willing to talk to, who can make them feel comfortable in any of these situations.
Mhm. I fully agree. Ricky, do you have any tips on talking to people with anxiety and like helping calm them down from an outside source?
Um, well, I guess if you're having an anxiety attack, there's lots of tricks you can learn from professionals like therapists, and they'll probably do a lot better than I am. But I know a couple tricks, like if you count five things in your room, basically, like five things you can see, then four things you can smell, three things you can hear, two things you can touch, and like one thing you're feeling right now. And once you get down to like the listing all those things, your mind is so unfocused on what you are stressing over that basically you kind of forget about it and you calm down. Then you can look at it from a more, I guess, rational perspective. But I don't know, that's one trick
Yeah.
that I can think of. There's lots of those little, I guess, tricks and tips that you can pick up from professionals that can really be helpful for everyday situations, because not everybody can, knows how to deal with that. So if you teach a friend or something like that too, it's very helpful because they can help you get through those anxiety attacks or anything like that.
Yeah, 100%. Yeah, and I think also just being able to like, there's also an argument to make to be able to like sort of teach those sorts of things, even in like a school curriculum, just to help, because general anxiety disorder affects a pretty large amount of the population, or anxiety in general. Even if you don't have anxiety disorder, just being able to calm down. So I think there's an argument to be made to both destigmatize anxiety and also sort of help everyone in general, is to sort of maybe start just teaching those things to people you know. If you didn't know that tip or trick or whatever, just and you know someone with anxiety, or even if you don't know someone with like diagnosed anxiety disorder, but someone who just sort of gets panicked pretty easy or flustered or whatever, being able to sort of calm them down and bring them down might help sort of destigmatize everything by allowing just sort of the normalization of these sorts of things to happen.
Yeah, the more knowledge that travels around, well, accurate and positive knowledge that travels around these types of disorders, the better the, well, opinion, I guess, of the population becomes. So,
Mm.
yeah. I don't know. Anything else to say on GAD, or do you think we should wrap it up?
Yeah, one more thing before we wrap up is it's really important to discuss this with your friends if you're feeling it, any anxiety, or like if you're scared for something, because especially in a student's life, there's lots of anxiety around tests and assignments and all of that. And it can really help you to discuss that with your teachers if that helps, with your friends, with anybody who you feel comfortable talking to. And it will help a lot.
Yeah, do not be afraid to reach out and talk to people.
Yes.
If like you could even reach out to us if you absolutely like if you need to reach out to someone. It doesn't matter who it is. Just being able to talk to someone, even if it's yourself in a mirror, go for it. Just talk to someone about it. Just sort of
Reddit's a great place to do that. It's a big
Reddit
community,
is-
or like any community you can find. Instagram, Twitter. People have these kind of communities that they have set up. It's
Yeah.
because it's not like back in the day where people didn't talk about it at all. We do have people to talk about it and are not affected by these horrible stigmas. So if you put in the work a little bit, you might be able to find it. And it's not that hard. Just type in communities for anxiety. I'm sure you can find Reddit, Instagram, Twitter, all these things with people that are, just there to talk. And they have tips and tricks all on their Instagram, and sometimes it's helpful. So people can look there if they want. But I think we should wrap it up. So that was a good discussion on GAD.
Yeah. Thank you for listening to episode 2. Episode 3 of the podcast, we'll be talking about bipolar disorder, more specifically bipolar 1 disorder. Thank you.